In this video, we're going to describe how to perform the manual muscle test for the deep hip external rotators. So I like to remember this muscle group by the acronym PGOGOQ, or piriformis, superior gemellus, obturator internus, inferior gemellus, obturator externus, and quadratus femoris. So that's your little acronym to try to remember these muscles. They are deep within the hip, so as we start talking about grading, we're not going to be able to palpate those muscles. So there's not really a grade of 1 on this muscle test, and I'm not going to have him go through the range and palpate because we just can't access those muscles because they're so deep. So first thing I'm going to have him do, he's going to be sitting. We're going to say that we've assessed active range of motion on his unaffected side, his left side. I've assessed active range on this side, and again, we're not going to palpate. So I do want him with his opposite leg foot supported by the stool so that he is able to maintain his sitting balance as I apply resistance. The next thing I'm going to do is I'm going to ask him to go ahead and kick my hand, and he's coming into hip external rotation. I'm going to stabilize at the knee with my opposite hand, and I'm going to push him into hip internal rotation. So notice my line of force is this way. So I'm going to show you this, and then we'll talk about grading. So hold nice and strong, Eric. Hold, 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 hold. Good. And I find what's best for body mechanics is for me to sit and apply this force just so I'm not kneeling or bending over significantly. In this position, if he's able to tolerate maximum resistance against my force, that would be a grade of 5. If moderate resistance, a grade of 4. If he's able to go through just the range of motion, so kick my hand coming into external rotation, that would be a grade of 3. For this test, a grade of 3 is tolerating mild resistance, and here's why is that if he's able to go through that full range of motion, I'm going to give him a grade of 2. We said that we can't palpate those muscles, so if he can just do the motion against gravity, it's not a ton of gravity that's resisting him with the vector of force, then he gets a grade of 2. An alternative position that we can place him in to obtain that grade of 2 would be lying supine. So Eric, can you lie on your back for me? And he's going to come into a straight leg position, and we're going to assess his active external rotation in what we call a log roll position. So if you notice his toes start pointing towards the ceiling, we're going to call that neutral hip rotation. Eric, can you point your toes out towards the side and just roll your hip open? So if he's able to do that through a full range, that would also be a grade of 2 for this manual muscle test.